Hi, my name is Kelly. This is my husband, John. You are listening to Let's Talk About It with Kelly. Today's topic, we're going to talk about male pattern baldness. When should you act? John? Good question, right? When should you act? What are the earliest signs do men usually ignore?
Well, that's a tough one. I guess a lot of people, if they are actually starting to experience hair loss, they might see some increased hair shedding. Mm-hmm. The beginning of a recession here is often an early sign. Mm-hmm. And some people might be in denial about it. Now, sometimes these early signs aren't really true signs of hair loss. So this is one of the reasons why we want to investigate further all the time.
Right.
Because pretty much every guy will get what we call a maturing hairline. So sometime between age maybe 18 and 25, they may get a little bit of a recession here, but it's not hair loss true. As you can see, I have a high recession. I'm 62 and I've got a recession here, but I don't have any hair loss on the top of my scalp. So this is just the way my hairline has matured over time. I mean, I guess you could call this androgenetic hair loss, this bit of recession, but that's all it is. The bit of recession, we call it a maturing hairline.
Right.
So teenagers might get that. People have met in their early 20s. Mm-hmm. You shouldn't ignore it. It's right to investigate it. Okay. So maturing hairline or increase in hair shedding, these are probably the first signs you'll see. So if you're experiencing that at all, then have it checked out.
For sure. Especially if one of your family members is having the same problem,
if there's a family history, then yeah, for sure you'll want to get that checked out.
So is it better to treat early or wait?
No, obviously you want to treat early. Well, of course, depending on, you're not going to do a transplant when you first start to lose hair.
Right.
You're not going to use a hair system or even do micropigmentation. Mm-hmm. You're going to use a treatment. So you do want to treat. If you're going to start a treatment to prevent the hair loss, mm-hmm. then you want to start that as early as possible, yes.
So what happens when men try to fix it themselves?
So I guess it depends how they try and fix it. And so one of the things I see a lot of that I really don't like is something called derma stamping, which is very silly.
Sounds scary.
And even derma rolling, I don't like. So the idea is that if you injure your skin, mm-hmm. somehow it's going to help your hair grow.
Well, I think that's good for your face.
Well,
that's what microneedling is.
Well, if you remove a layer of skin off your face, your skin's going to rejuvenate.
Right.
Okay? But if you remove or damage the skin on your head, it's not going to cause your hair to grow.
Because it can damage the follicle, correct?
Very unlikely. Now, I've seen derma stamping that's been pretty severe. But here's the thing to remember. Follicles and stem cells are residing quite deep in the skin. So, especially when the hair is growing. So those stem cells are going to be 3 to 4 millimeters, maybe even more below the skin.
Okay.
Mm-hmm. A derma roller goes a millimeter into the skin, not 3 or 4 millimeters. Did I say millimeters? Millimeters. So a derma roller is not going to get anywhere, near the stem cells. Even a derma stamp is probably not going to get anywhere near the stem cells. But these things break hair. They cause damage to the skin.
Okay.
I see scabbing. I see damage to skin. I do see people who damage their skin enough that they may have affected some hair follicles. So, it's certainly not triggering any hair growth. The only thing it can possibly do is damage them. So this is...
So try not to take anything on yourself without...
Well, yeah, I mean, you got to be aware. So you said your question was, what happens when they try to fix it themselves? Well, yeah. The biggest problem is reading about or seeing all these treatments online that don't work. So what happens is people waste a lot of money, a lot of time, maybe do more damage than good if they try and treat it without getting properly educated and seeing a specialist before they start.
Can male pattern baldness be slowed down?
Sure can. So we have effective treatments. There's lots of effective treatments that we know that work. There's medications, minoxidil, finasteride. They can be done orally or topically. We have laser therapy. We have PRP. We have exosomes. Those are the main ones that have good evidence. There are some others. But certainly these treatments can slow down pattern hair loss. Absolutely. They can even reverse it to a degree. Now, you very seldom will, if you get someone who's got a medium advanced hair loss, they're not going to grow all their hair back sort of thing, but you can certainly reverse it to an extent and improve the density. We do that all the time with our patients.
Okay, good. When is a transplant appropriate and when isn't it?
It's a complicated question. So the thing about a hair transplant is it really depends on the amount of hair loss a person has and what they expect in terms of results, what they're looking for.
Right.
So it's appropriate when a patient has a realistic understanding of what a hair transplant can do, okay, because it does have limitations. So if a person comes in and they've got, advanced hair loss and they're expecting a full head of hair from a hair transplant,
it's not going to happen.
It's not going to happen. It's not appropriate. And you don't want to do it because the person's not going to be happy.
Right.
So
you don't want to give them something that they're not going to be happy with at the end of the day.
Exactly.
Yeah.
Exactly. So, you can't say it's not appropriate for that person because of the amount of hair loss, because they might be happy with a little bit more hair in here. We can only put a little bit of hair in the top. So say a person's got a whole bald head. He just wants a little bit more hair in here to frame his face a little bit.
Right.
And he knows what's going to happen, then it's fine. So you can't say, it's not appropriate on advanced stages of hair loss. It is appropriate if the person knows, the limitations. Okay. So it's not appropriate when a person expects too much from the transplant. It's not a way of restoring all the hair you've lost. It's very limited as to how much hair you can restore.
Okay, great. What non-surgical options are most effective?
Non-surgical options most effective as treatments?
As treatments, yes. So PRP, a hair system.
Well, so hair systems and treatments are very different things.
Yeah,
right? So,
but it is a solution.
Hair systems, they're non-surgical. They can be very realistic looking now. They are very realistic if they're done properly. They are becoming more affordable. And as long as you have the right technicians and good quality product and services, then you can have a really great full head of hair with a hair system. So it's a great non-surgical option to replace hair.
Absolutely. And we do this. we do this every day. Do genetics always win? Because you talk about genetics a lot.
Well, in the sense that, you can't reverse genetics. So when we do a treatment and we're fighting a genetic hair loss, so we're fighting androgeneticalopecia, you can't cure that. You can treat it. So we can win.
I think so.
But we can't cure it.
Right.
But we can certainly...
But it doesn't always win.
We can certainly defend and win.
Yeah. Because, a lot of dermatologists say genetics is nothing we can do.
Nothing.
Genetics.
You get that. You hear that a lot. There's nothing
but
you
that's
can do.
Not true.
There's a lot we can do.
Exactly. Okay, good. What does a realistic outcome look like?
For a hair loss treatment?
Yes. For men.
So another tough question because a lot depends on the specific person, but I want to see, someone who has any amount of hair loss, whether it's, a Norwood 2, where they just have a little bit of thinning in the temples or in the top, or a Norwood 5, where they're, the crown's basically gone and there's very little hair up top.
Mm-hmm.
I want to see, what's the question? Realistically.
Yeah.
Realistically, I can expect a minimum of 20% more density.
Okay.
10 to 20% more density.
That's a realistic outcome.
That's a realistic outcome. Or stopping the progression of hair loss is also a realistic. If you have a person in and they're shedding,
Mm-hmm.
and from the top area, and then we do some treatments and we stop that shedding,
Yeah.
that's a great result.
Right.
Because as soon as you stop shedding, you're going to get an organic or a natural rethickening because hair is not going to be falling out anymore. So the hair that's coming in is going to eventually fill up the scalp a little bit more. Now, it's true that hair may be miniaturizing, so we do want to treat it, keep treating it to try and improve the thickness. So, but, a realistic objective is to stop hair shedding and get, 20% more hair. We've seen a lot of examples where we'll get 50% more hair.
That's right.
A lot more hair. We
Yeah.
see, so everyone responds differently. We want to see, you got to see an improvement. We want to see an improvement. We can always we can always expect some improvement.
So, and realistically, you're not going to promise somebody that they're going to have a full head of hair when they're not.
Absolutely.
So
No, that's
it's better to underestimate and over-deliver, correct?
Well, that's in business. That's what you do. You under promise and over deliver.
Yeah.
But again, we always give people a realistic, goal. When they come in, that's important. You want to, you got to motivate them. They want to be, we want to motivate people to know that they can get improvements.
Right.
And, they do have to be realistic about those improvements, but there are expected improvements. Absolutely.
Yeah. Well, the one thing that a lot of patients say about you, John, is that you're very honest. Very honest with them. So
that's good.
It's a great compliment.
I try to be.
Good. Okay. Well, that's great about this topic. Our next topic next week is going to be top hair loss myths we hear every day. Great topic, because there's a lot of myths out there, right, John?
Certainly is.
Okay, so stay tuned. Look for the next episode on Let's Talk About It with Kelly. Thank you.
Thanks. Bye-bye.
Bye.